Chair Listock. Good afternoon, Madam Chair, members of the committee, Kelsey Ann Funk, staff to the Human Services Committee. Before you today is the striker from the Human Services Committee for second substitute House Bill 1470. By way of background, a private detention facility is a detention facility operated by a private, non-governmental, for-profit entity and operating pursuant to a contract or agreement with a federal, state, or local governmental entity. Legislation from 2021 prohibited the operation of a private detention facility, but exempted certain facilities and grandfathered facilities operating under a valid contract in effect prior to January 1st, 2021. The striker before you does four things. First, it requires the Department of Health to adopt rules and set health, safety, and sanitation standards for private detention facilities, such as clean living areas, safe indoor air quality, and infectious disease control. Second, it requires the Department of Health to inspect food safety and handling, test water and air quality, and investigate complaints. It also requires the Department of Labor and Industries to inspect working conditions for detainees. Third, for private detention facilities with contract effective dates after January 1st, 2023, it sets operational requirements such as access to telecommunication services and visitation, mental health evaluations and medical care, and emergency response plans. Lastly, it creates a private right of action for negligent and reckless violations and a civil penalty of up to $1,000 per violation per day. The Attorney General can bring an enforcement action to recover unpaid penalties, which must be deposited into an account created in the bill, and there are exemptions for certain facilities in the bill. And I'll turn it over to Monica.
Thank you. Monica, could you hold on just a minute? Of course. Can you all take the conversation to the back because it's hard to hear? Thank you.
Monica Fontaine, staff to the committee. So much like the prior bill, I have the fiscal note to the second substitute, but a fiscal note to the amendment has been requested and is not yet available. The Department of Health estimated $1.3 million general fund state across the 23-25 biennium with an ongoing cost of $661,000 per fiscal year starting in 2026. The department will start rulemaking on the standards outlined in this bill on July 1st, 2023, and is estimated to be completed by December 31st, 2024, and it estimates these activities to cost $242,000 in fiscal year 2024 and $107,000 in fiscal year 2025. There's an initial cost of $54,000 in fiscal year 24 and fiscal year 2025, with an ongoing cost of $41,000 per fiscal year thereafter for a registered dietitian to review menus and conduct nutritional analysis. The cost to inspect the detention facilities is anticipated to begin in fiscal year 2026 after completion of rulemaking and system development, and is estimated to have an ongoing cost of $256,000 per fiscal year, which includes about 2 inspections per year related to these standards that will be created in the rulemaking process. Starting in fiscal year 2024, there are costs of $566,000 to implement a new system for investigations and enforcement and for the enforcement activities conducted by staff. The Office of the Attorney General estimated an impact of $43,000 to the legal services revolving account during the 2023-25 biennium for services provided to the Department of Health related to rulemaking, creation of penalty regulations, and other legal services. Penalties collected by the Office of the Attorney General are deposited into the Humane Detention Account, which was a non-appropriated account created in this bill, and the House Chair fully funded this fiscal note.
Senator Wagner.
Thank you, Madam Chair. And I guess I'm kind of ignorant on private detention facilities. I'm looking at the background and it says they are typically owned and operated by local governments. So isn't that kind of the opposite of privately owned?
I think you might be looking at just the definition for detention facilities in general, which could be like a jail or a county juvenile facility.
Oh, it says private detention facilities.
Oh, sorry.
Anyway, an explanation of what they are and where they are would be helpful to me.
Right. I believe, according to the fiscal note, only one facility would be covered by this bill, and it would be the Northwest Detention Facility in Tacoma that has a contract with the federal government, the Department of ICE facility, Department of Homeland Security.
Follow up, Senator Wagner, are you good? Okay. All right, thank you both very much. Let's have a public hearing. Aaron Dilworth is on Zoom, I'm told. And Hannah Warner, why don't you come forward? Aaron, are you ready to testify?
Yes, we just switched me to a panelist.
All right. Welcome.
Okay. Hello, Chair Rolfus and members of the committee. My name is Erin Dilworth. I'm the Deputy Director for Communities for a Healthy Bay, formerly Citizens for a Healthy Bay, or CHB. We're in Tacoma, and our office is within a stone's throw of the Northwest Detention Center. I'm here to support House Bill 1470. CHB has received a lot of complaints about drinking water and air quality in and around the Northwest Detention Center. Concern that these issues could be related to the toxic legacy of the tide flats where the detention center sits, or current day pollution, or the groundwater well at the facility that is actively being drawn from. I decided to map out which entities were responsible for what so I would know who to talk to. I ended up with a complex matrix of regulatory pathways and authorities, and it was really hard to understand. It's my job to understand how how environmental and public health is regulated. When I started making phone calls, I heard a lot of not-its from agency representatives, both locally and at the state level. It was really frustrating. House Bill 1470 is crucial to ensure accountability for private companies doing business in the state of Washington, especially one that holds the safety and livelihoods of so many in their hands. Thank you.
Thank you very much. I was wondering why the Communities for a Healthy Bay was testifying, so that's helpful context. Thank you for helping us out.
You're welcome.
All right, Hannah Warner.
Good afternoon, Chair Rolfus and members of the committee. My name is Hannah Warner, testifying on behalf of Columbia Legal Services in strong support of second substitute House Bill 1470. This bill creates an efficient oversight system that will keep private detention facilities in our state accountable. Requiring regular, unannounced inspections of these facilities by the Department of Health and the Department of Labor and Industries will be vital to ensuring that all people in Washington enjoy basic health and safety protections. These agencies already have many of the necessary oversight structures in place and will have the ability to collect fines for health and safety violations under the bill, helping to offset the modest fiscal impact of this bill. We urge this committee to support this bill. Thank you.
Thank you for joining us. That we only had 2 people signed up on this bill, so that concludes the public hearing. We'll go into the next bill.